Hi, my name is Hassan. I will be talking today about schizophrenia. Schizophrenia is a psychotic disorder. This is the word schizophrenia, the Greek word itself. It means schizo means split, phrenia means mind. It refers to mind split from reality. In this disorder, person's thoughts, perceptions, and behaviors are impaired to the point where he or she cannot function normally in life. Some people diagnosed with schizophrenia have abnormal low brain activity in brain's frontal lobes. Many studies of people with schizophrenia have found enlarged fluid-filled areas and corresponding shrinkage and thinning of cerebral tissues. Primary symptoms of these disorders are hallucinations, which are perception experiences occurs in absence of external stimulations. Therefore, there are three different kinds. Auditory hallucination, meaning hearing voices and this is the most common form. Second, visual hallucination, seeing things that are not present. This is the less common form. And lastly, the olfactory hallucination, which is smelling odors that are basically not present there. And it is also a less common form. The second type of example or not the symptoms of hallucination is called delusions, which are the beliefs that are contrary to reality and firmly held, even in the face of contradictory, clearly very absurd. So some of the forms it has of delusions are paranoid delusions, which means false belief that others trying to harm them. That's what they think. And another one called grandiose delusion, which basically means the person believes that one holds special powers, unique knowledge, or it is extremely important. Third is somatic delusion, which basically they believe that something abnormal happening to one's bodies. For example, kidneys are being eaten by insects or something, for example. And then lastly, thoughts are being removed or thoughts are being inserted in their minds. Another primary symptom of schizophrenia is disorganized thinking, meaning they are disjoint and incoherent through processes. Example, jumping from topic to topic, not concentrating to what they are talking about. And then another one is disorganized or abnormal motor behavior, usually unusual behaviors and movement. For example, giggling and self-absorbed smiling, purposeless movement, odd facial expression, gestures, and another thing is catatonic behaviors. And then lastly, another primary symptom of schizophrenia is negative symptoms. That means that they reflect noticeably decrease in absence in certain behaviors, emotions, or drives. Some examples are avolition, lack of motivation, alogia, reduced speech output, and anhedonia, exhibit less interest in normal pleasure activities that people think are the norm. Prevalence, according to the National Institute of Mental Health, NIH, the estimated prevalence of schizophrenia and related psychotic disorders in the US range between 0.25% to 0.64%, which is recently updated in May 2018. According to the video that we watched in the module 8, towards a new understanding of mental illness by Thomas, everyone in every 5 people will suffer in their lifetime with schizophrenia. Another one is that 50% onset by age 14 and 75% onset by age 24 of schizophrenia. And treatment of schizophrenia. Schizophrenia requires sometimes lifelong treatment, depending on the symptom, treatment with medication and psychotherapy can help manage the condition. In some cases, hospitalization may be needed. According to one of the mental illness is called National Alliance on Mental Illness, antipsychotic medication are the most commonly prescribed drugs for schizophrenia. They are thought to control symptoms by affecting the brain neurotransmitter dopamine. Thank you for watching.